"72-year-old Edward Sewanyana now spends most of his time practicing a number of drills in a stroke rehabilitation center since February this year. In our conversation with Sewanyana, he told us that he is a two-time patient of stroke. He said he got a mild stroke in May 2015, which he paid less attention to. In February this year, he fell off his bed as he tried to rise for his daily routine, and he could not move any part on the left side of his body.
My wife came and asked what had happened. She said, I've fallen off the bed. So he called him, the children to come and lift me back on the bed. He rang up my young brother, who was in Kampala, said that your brother had fallen off the bed. The brother said, that is a stroke.
He was taken to hospital where he was diagnosed with stroke, which instantly left him disabled.
I can walk now. When walking, his hand hasn't changed at all. It is still paining me terribly.
Dr. Joel Chiryawire, a neurosurgeon with International Hospital, Kampala, described what could have possibly happened to Edward.
One is where a blood vessel gets blocked, and whatever part of the brain which is supposed to be supplied by that blood vessel cannot get any blood. That is, we call the ischemic stroke. The other one, which is more dramatic, is the hemorrhagic stroke, where the blood vessel bursts and you get blood pouring into the brain. Basically, the brain is being affected, it's not functioning well because it's not getting enough blood or because the blood vessel has burst.
Dr. Chiryawire said anyone is at risk of suffering from the disease, though it is common amongst people above 60 years of age.
If you look at the trending now, because there's what is the fixed larger numbers, but if you look at the trend from what the studies were previously, you see that there's a growing number of young people who are getting stroke, especially in the 40 age group. So in our setting, increasingly the age group is coming down to 40 years of age. The other people who are at risk are those who have got heart problems, those who have got issues with blood pressure, patients who have got diabetes, patients who have got a history of stroke within their family are also at risk of getting a stroke.
Edward Sewanyana was handed a training schedule which he has to follow to be able to regain ability to move his limbs.
I come here every day.
For how long?
Since Feb. I come at 8, sometimes at 9, and I leave at 7. There's a little difference now. So I think after time I'll be okay.
He was also given other drugs to prevent other illnesses like goiter.
You can have problems with your eyesight, you can have problems with your vision, with your hearing. You can have seizures, which is another common problem. People get epilepsy from having had a stroke before.
However, this depends on the impact on the brain.
If you've got the stroke in an area where your intelligence is, then your intelligence will go, and you find people who get confused, you find people who change personality, you find people who get even violent following a stroke. You'll also find if it is the area which deals with speech, then you won't be able to talk. And that also becomes an issue. You are unable to communicate with the people around you.
Those who recover up to full function, or to 95%, it means that their damage at the brain wasn't so much, was mild. But those who recover 50% means that there was a severe damage, or there was a time lag by the time they reach the hospital.
Dr. Ibrahim Bukenya reveals what transpires in a rehabilitation center.
These people are brought in here when they can't walk, when they can't control their bowels and bladder, when some of them can't speak. Some of them can't use their hand. Some of them can't express themselves. Some of them can't sit. Some of them, we told them it will take a shorter time. Some of them, we tell them it will take a longer time to recover. And some of them, we tell them to adjust their roles.
The road to recovery is littered with challenges.
They have different modes. Some of them comply to the rehab, some of them are aggressive. So it's not an easy therapy. Africans, we sometimes believe in witchcraft. So we get many information coming in here and there. So some of them lose hope and then they are taken away. Or some just get fed up with the whole program. Mainly those who lose their interest, they are those who have been affected severely.
These patients are on lifelong medication, most of them. And because of that, they have a continued cost. It's not just a hospital cost.
According to Dr. Joel Chiriawire, the National Referral Hospital, Mulago, receives up to 2 patients daily, a figure he says is alarming.
A colleague of ours who did a study in Mulago had about 120 patients who were admitted over the year. And so that is a crude method of seeing that, it's not a small number.
Studies in developed countries like the United States of America and Europe show that stroke is the leading cause of disability. Even when the prevalence of stroke, a non-infectious killer disease, is on the rise, experts from Mulago Hospital say there has been little effort directed to curb the disease from the Ministry of Health. Dr. Joel Chiriawire advises that anyone who clocks the age of 40 should go for regular medical checkups to avoid the condition. Walter Mwesije, NTV.